Adrian Dix. I'm the BC Minister of Health. Beside me is Dr. Bonnie Henry, BC's Provincial Health Officer. We're honored to be here on the traditional territory of the Lekwungen-speaking people of the Songhees and Esquimalt First Nation. It's my honor to introduce Dr. Henry.
Thank you and good afternoon. Today for our COVID-19 update, I can report that we have 53 new test positive cases in British Columbia, bringing our total number of people who have tested positive to 1,066. 1066. That includes 497 people in Vancouver Coastal Health, 367 in the Fraser Health Region, 72 people here on Vancouver Island, 114 now in Interior Health, and 16 in Northern Health. In addition, we're up to 21 long-term care or assisted living facility outbreaks. And I mentioned yesterday that our number of outbreaks has increased quite a bit. We had 19 yesterday, but that really there are two major outbreaks and that we have learned quite a lot from them, particularly the Lynn Valley Care Centre. And so there is a very low threshold for testing people in long-term care, both residents and staff, and even a single staff case or resident case is treated like an outbreak, or is managed very aggressively as an outbreak. And I was noted yesterday that we are no longer listing the names, but they will be available on the statement so that you know exactly which facilities have been affected so far. In terms of the outbreaks, the Lynn Valley Care Centre continues to have ongoing issues with two new cases identified, although the measures in place there are now, we hope, beginning to take effect. It just really reflects the challenging situation when you have transmission ongoing in a facility and the importance of catching these really early. For most of the other ones, it's a single person who has been identified, and the measures so far seem to be mostly effective. I will say we now have 142 test positive cases who are hospitalized around the province, and of those 67 are currently in critical care, either in the intensive care unit or the high acuity units. We have had one additional death in the Fraser Valley region, bringing our total people who have succumbed to 25 in the province. We also now have up to 606 people who have been fully recovered and are no longer requiring isolation. There was a couple of things that I have mentioned over the past couple of weeks, one of which is that we have been working on and have developed an ethics framework for our response to COVID-19, and there are several different parts of it. There's an overall framework and a worksheet or a workbook approach that allows us to address a number of different questions, and that framework is now posted publicly on the BC CDC, the Government of BC website, on my Provincial Health Officer website links, but under the COVID response links on the government gov.bc.ca website. As well, we posted the ethical framework around duty to care that comes out of the large framework, and one on the allocation of personal protective equipment. And that is the framework that we have been using to ensure that we maximize the resources that we have to best protect people in our healthcare system. We also I've mentioned this in the past, have developed an ethical framework around allocation of scarce resources, things like ventilators. And part of that is a structure for how those decisions will be made so that no single individual clinician or healthcare worker will have to make those entirely terrible decisions on their own, that it will be done within a framework that respects the value of every individual life. That one is in the final phases of completion and will be posted publicly as well when it's ready. I just wanted to reflect a little bit on our discussions yesterday. And as we talked about yesterday, this is a very challenging time for us. It's hard to know how things are going to go. Right now, we seem to be holding our own. But without a doubt, we will get through this. We will get through this no matter what happens. But we do have a few more weeks to go. Our goal is to have these restrictions that we've put in place and the orders that we've put in place for as short a time as possible. But we also need to be mindful that we need to increase our activities in society in a way that is not going to tip us over an edge or increase the number of people who are becoming infected with this disease. So it needs to be done in a very thoughtful way. And I want people to know that we have been thinking of this. We've been thinking about all the possibilities that might happen in the coming weeks and months, and of course learning from the experiences around the globe. We are more committed. The more committed we are right now, the less those outside of healthcare will need to do later. And I think it's incredibly important for us now to maintain our strong social connections at a distance. It's one of the best ways that we can take care of ourselves and our families and our communities. And I've actually, there's a lot of examples that I've been seeing over the last little couple of weeks and days. And the things that make me smile and make me realize that we are going to get through this together. One of them, of course, is the 7 p.m. cheer that we get. And my neighborhood does that too. And we go out there with our pots and pans. Things like people leaving flowers and groceries on the doorstep for their neighbors and how appreciated that is. We've been seeing young children having virtual kindergarten and virtual play dates. And I know more of the virtual teaching and learning will be happening in the coming days. Evening gaming marathons with teens. I mean, my young people in my life tell me how much, they get to do stuff that before they used to have limits on. But you know what? These are the things that keep young people together too. We know there's stories of history teachers working with students to document their experiences during this extraordinary time. And I think that's something that we need to think about, the things that we're spending time on now and what this will mean for us in the future. We've seen more people with friends and family chats on using social media, using video, using FaceTime than we've ever had before. And then there's some really interesting things like the Canadian flour mills are working 24/7 right now, because hundreds of loaves of fresh bread are bought on Instagram every day, which is kind of different and good for us. And there are many other examples of people doing the right thing now. You know, the other part that we're seeing is community collaboration and businesses and communities wanting to contribute. And we've had hundreds of offers of support, many of which have come into me in my personal email. Not that I've been able to answer them all, but I have forwarded them on to many of the great team that we have that are looking at what we can use and how we can use the support of people in our community to keep people safe. So we also have direct donations from a lot of great companies like Safe Care BC. And it was announced earlier today, there's now the COVID-19 Supply Hub, where we can collaborate, we can tell people what we need, and government and businesses around the province can contribute to that. So I think that's a great way for now to try and work on this together and solve these problems together. So these donations, these offers of help, and these many, many examples of community connection really do show me that we will get through this, and we'll get through this together. Thank you.
Thank you very much, Dr. Henry. As Dr. Henry has said, 53 more cases of COVID-19 today, and a number of more people in hospital, a number of more people in ICU, and one more death. And we wanted to pass on to the families and the friends and the caregivers of that person and the 25 people who passed away from COVID-19 in BC. Our condolences, our thoughts are with all of you. I wanted to talk briefly about some of the issues in acute care, just to keep you up to date on where we stand today. We have today about 4,192 beds, empty beds in acute care in British Columbia. That represents 61% capacity in our acute care system as it stands today. We've added capacity, and of course, there's been a significant reduction in population in acute care hospitals. Equally, about 55.5% of our critical care beds are occupied right now in acute care hospitals. Just to put in context what's happening out there in the system, you see that people are using healthcare for other reasons less at the moment. This is for a number of reasons. We have, for example, seen a decline in regular ambulance calls. For the most recent day, 1,311 against an average of 1,540 in an ordinary time or the pre-COVID time. Equally, there are fewer emergency room visits right now. On March the 9th, that was 3 weeks ago, on Monday, I believe, there was 6,559 emergency room visits in BC. As of March 30th, 3 weeks later, there were 3,274, which is significantly less. We want to continue to thank all of the people who are working in healthcare, who are also all of the essential workers that are ensuring that our grocery stores have food and supplies, that are doing that work. That involves truckers and grocery store workers. I want to especially express our appreciation to them and all the people working every day in healthcare. I think this is a moment, the Premier said it last night, Dr. Henry said it very clearly again today, and I think every day, that this is the time we have to be 100% all in on all of the measures that have been taken. I want to just focus briefly today on one of those measures, which I think is significant and which faces us. As many of you know, initially when we did our testing and when we were dealing with the initial cases around COVID-19, they involved principally travel to Canada from other places. And that was the focus of our effort, to ensure that those the possible links of transmission were broken, and that we would slow the spread of the disease at that time. As you know, there are tens of thousands of Canadians now registered with Global Affairs Canada, Canadian passport holders, many of them looking to come home from other countries. And the Government of Canada is engaging in significant efforts to ensure that they're brought home. And I want to say this, first of all, that the Government of Canada did an extraordinary job in organizing an evacuation of Canadians from Wuhan. Everyone, as you'll remember, went to Trenton, Ontario. Nobody who was evacuated became sick with COVID-19. Equally, in the case of the Diamond Princess, which came from Japan, people who cleared the ship who were not sick came back, I think in that case, to Cornwall, Ontario. And the Government of Canada, again, no one got sick, and that was an extraordinary logistical effort from the Government of Canada, which I'm sure we all appreciate. We'll also know that people came from the Grand Princess, which was off the coast of California. And on the Grand Princess, a number of people did get sick. They were quarantined. They did come home and were quarantined. The Prime Minister said today that, and I'm quoting him, "I can tell you that the entirety of Global Affairs Canada employees are single-mindedly focused on this Herculean task of bringing Canadians home any way we can. And much of it involves negotiating with other countries to get permission to cruise ships to dock, permissions for airplanes to lift off from the country where they've closed airspace, etc." And we know of these efforts and the flights that are coming back and so on. And I think it gives us a chance to reflect on two things. One, our responsibilities as governments in that context, and one, our responsibilities as people. And the first thing I would want to note is our responsibility of people. And there are no exceptions to this, not one, not a single one, of someone who would come back on such a flight, especially one organized by the Government of Canada, to their absolute requirement to self-isolate when they get back to Canada. And there can be no ambiguity about this fact. It would be, I think, a real betrayal of the people in your community to not follow those rules, which are, by the way, also the law at the federal level and the order at the provincial level. And that's our responsibility. And everyone who comes home, everybody who comes home has to understand that and to follow those rules. That is one of the ways that all of the efforts of the millions of people in British Columbia and the tens of millions of people in Canada will be supported when people come home. That's their obligation. And I think there's an obligation as well, whether it be at YVR or whether it be for people coming back from sun destinations to airports like Kelowna, to ensure that they are met with a very significant presence. There can be no ambiguity anymore, if there ever was, about people's obligations when they get home. No ambiguity as to as people's responsibility to self-isolate. No ambiguity about the need for the Quarantine Act in Canada to be enforced at the airport in every case that it is required to be enforced in. And I think that will require even more efforts. And I know that the federal government is planning some efforts, and we have certainly communicated our strong support for a very clear sign in every case, without exception, when people come home, that the rules that apply here, the rules to self-isolate, the rules the rules that are needed here have to be imposed before people get on the plane and after they leave the plane. This is critically important. It's important for all of us. And if it's the case, for example, that people are coming from cruise ships to here, when previously in those cases there was separate quarantine and now they're being asked to self-isolate in community, it is critically important that those rules be ensured and be communicated without ambiguity, clearly, plainly, and with force. And I'm hopeful that that will happen. That will continue to aid the efforts of millions of people in British Columbia. And I wanted to say just finally, because I think these are very difficult weeks that people need to understand. I think last night the Premier said it well. He said that all British Columbians need to recommit to doing their part, and we do. He made it clear, stay with this. There are some signs that the actions we're taking are making a difference. I don't doubt that, but we can't stop now. We just cannot stop now. So today and every day in this effort, our BC task is simple. Dig deeper, work harder, keep working together, keep physical distance, stay 100% committed. We need to bend the curve, we need to stop the spread of COVID-19, and we need to be all in 100%. We're happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue and unmute your phones. You are not audible until we call your name. First question today is from Penny Daflos at CTV. Go ahead, Penny.
Thank you so much for taking my question. The WHO now says they're looking at considering endorsing widespread community use of masks, and the US CDC is actively considering it. Are you going to consider recommending consumer-grade or cloth masks to the public, especially when there's so much evidence of asymptomatic carriers?
Yeah, so obviously this is something that we've been considering as well, knowing what's been going on around the world. I think the really important points are that, as we all know, the supply of medical masks and respirators is tenuous, and it needs to be reserved for our healthcare workers and for those who care for people with COVID-19 and other patients in hospitals. So that is paramount. Having said that, we know things like physical distancing and hand washing on a regular basis, not touching your face, are proven measures that prevent the transmission of this infection. And we've been practicing our physical distancing, and it is making a difference. So we know those measures work. The use of non-medical masks, so things like homemade or cloth masks by people who don't have any symptoms, may reduce, in some cases, the touching of your face, although we do need to be careful with putting them on and taking them off, and the importance of washing your hands or cleaning your hands when doing that. But we also know that they can have some benefit in keeping your droplets in. So they're not, we need to be a little bit careful, they're not a medical mask, but they can keep your droplets in when you're out and about with others. What is not proven is that they provide you any protection, and I think that's the really critical part. So if you are going to wear them, it can help reduce the droplets that you shed into the environment, and if somebody is infected and has mild symptoms or early on in the illness, it can prevent you from putting those droplets out, and that's probably okay. But it's not, you can't use it in isolation and think that it's going to protect you and that you no longer need to do things like cleaning your hands regularly or maintaining those physical distance. So in those contexts, I think it's not something that's proven, but it is something that probably does no harm. I think we need to be careful about materials, and we've had incidents in the past where people, particularly people who have lung conditions, if you're not using something that is easy to breathe through and that you can wash regularly, then you can be increasing your risk of contaminating yourself or causing additional problems. So a bunch of caveats, but I'm not against it in terms of if people want to use it as a way to try and keep their secretions in particularly when they're outside or out in other environments.
Vaughn Palmer, Vancouver Sun.
Good day. I'm still hearing a lot of complaints about us not doing enough testing in British Columbia, and you've answered, I think, quite thoroughly the strategy that you're prioritizing high risk, you're doing long-term care homes, you're looking at healthcare workers, you're looking at people that have been exposed or with symptoms. The one thing I don't understand is this also a scarce resources situation? You're having to prioritize who you're testing because we only have a limited capacity to test. And therefore, if we had more capacity, would you then be testing some of these groups that people are concerned about, like people that are self-isolated, people who've been in contact and who've been sent home and told to isolate themselves?
Yeah, so the short answer is not really. So it's a combination. Certainly early on, we had a capacity issue, and we were getting a lot of tests that were, I mean, if you think about it, our test positive rate, so our percentage every day that was positive was quite low. It was very low. It was less than 1% for most part. And we were testing all kinds of people. So that was not a good use of the resource. We've now dramatically increased our testing capacity, and we're using all of it up until very recently. And what that has shown us is that in the last couple of days, we've saturated a lot of our high-risk populations, but our percent positive per day has gone up, which means we're testing the right people. We're testing the people who are more likely to have this, where there might be an intervention that we need to do. For example, people who are sick enough to be in hospital, people who are part of a new cluster, and I talked yesterday about a community outbreak in the interior, people who are part of something that's an indicator of an outbreak. And those are the people that we're testing now. We're particularly focusing on testing people who are in those environments that are high risk. So we have a testing strategy in the shelter system. We have a testing strategy in our long-term care homes, because we know it makes a huge difference if we detect those places early. So that part of it is directly focused, and we want to make sure we have the capacity for that. It's still, we still would not be testing everybody who has very mild illness for a variety of reasons, not only because of capacity, because it's a waste of resources for a lot of people, but also because we know this test is not 100%. And early on, and when people have very mild symptoms, it can be falsely negative. So it doesn't change what we're going to tell people. We need to tell them on a population level, anybody who's sick, if you have, especially if you have a fever and a cough, you need to stay away from others, no matter what, whether you have COVID or anything else. And so it doesn't change that message to people. And when people are coming in from countries where we know they've been exposed to this, it still doesn't change our management of them. They need to know, and we talked about this, they need to know that they're at risk of this, and they need to stay home and isolate themselves so they're not passing it on to anybody else. And that's their obligation right now. So the answer is not simple, and I know it's challenging to say it over and over again, but we do have a strategy that's based on the best use of the test with all of the limitations the test has itself. I will say as well that that's not the only thing we're doing. We're doing what we call surveillance testing. So this is understanding the rates in the community And we've been doing that from the beginning. I've talked about this before. It's how we picked up some of our first community cases, where we automatically, if somebody has a test for influenza, for RSV, which is another respiratory virus, we automatically tested for COVID as well, and we're still doing that. And we have what we call our Sentinel Physician Influenza Network. And they are a group of physicians around the province who routinely test people who have influenza-like illness, which is a respiratory illness. And from the beginning, we've been using those tests as well to get a sense in our community of whether people who have influenza-like illness have other things or have COVID. So we're still doing those tests as well. And they have occasionally come up positive, and that leads to an investigation in that area. What we need to do now, and what we actually spent a few hours talking about this morning, is developing our strategy going forward that allows us to continue to target where the most important efforts are. So people who are hospitalized, people who are in long-term care, healthcare workers, certain high-risk settings. For example, some of our more remote communities, making sure we have a rapid testing strategy should we have people who become ill in those communities, and looking at expanding our surveillance in the community to get a more detailed sense of where we're seeing transmission in our communities in a broad scale. So kind of a lengthy answer, I'm afraid, but this is what the WHO has been talking about. We talk about containment strategies and then mitigation strategies, and this is a balancing of containment and mitigation, knowing that our testing is not unlimited, and that we need to, particularly some of the supply chains for the testing, things like reagents, are still tenuous around the world. So we need to focus it and do it in the most thoughtful way that we can, that gives us the best information to understand what's happening with the pandemic in our community as we're going forward. So that's the short answer. I will also, the long answer, I will also say that, you know, if we look at our testing per capita and the testing per million people that we're doing in BC, we're like still one of the top in the world. We're doing more per capita than many other jurisdictions, and we're up there with South Korea, and Quebec has rapidly ramped up their testing. But so it's not like we're not testing, and it's not like we're just saying, oh, only a few people can do it. It's just our strategy has changed to focusing on where it makes the most difference and where it gives us the most information.
Next question is from Ethan Sawyer, CBC. Ethan? Okay, moving on to Jack Emberley, Maple Ridge News.
Some life-altering medical procedures have been canceled. One on Vancouver Island involves a man with wet macular degeneration. His ophthalmologist scheduled him April 2nd for a time-sensitive procedure needed to save his vision, but she closed her office, canceled the procedure, and informed him all ophthalmology offices on the island had done the same. Are eye doctor clinics private businesses that can decide for themselves if they'll stay open or closed for their own safety, for example? Or does the government of BC set criteria that clinics must respect? I have an important, short follow-up question.
Sure, and you know, we've talked about this before, the unintended consequences of much of what we do. So there is guidance that I gave to the colleges. So ophthalmologists belong to the College of Physicians and Surgeons. We have a regulated health professions, and there was guidance to all of the colleges about appropriate community care during this time. And it allows for provision of emergency care for those types of very critical either life or emergency urgent situations. So there is provision for that for dentists who need to do emergency procedures and for other health professionals as well.
Next is Andrew Stuckey, Osoyoos Today. Okay, moving on. Ashley Legasic, CFJC.
For Minister Dix, your former caucus colleague Harry Lally has suggested the government open up residencies for doctors who have trained outside the country and are seeking residencies in Canada. He says it could add needed capacity to the health system. Is the government considering this?
So I'll take that one just because it again refers to the college, and it's the college's College of Physicians and Surgeons who certifies physicians and licenses physicians for being able to work in the province. And there's a time of crises is not necessarily the time where we want to modify the requirements that people need to have to ensure that they can practice in a safe way in this province. Having said that, there are opportunities that we've been managing it both in BC and across the country for medical students, for residents who have not yet finished their qualifications, for international medical graduates to be able to be part of the response and support the health response, whether it's working with us in public health or in other areas under a supervised setting, so that even though they aren't licensed, they can be part of the response. So I think that's a really important role where our colleagues with the expertise that they have who have been trained in other countries can be part of this. I don't know if you want to add.
Good. Next question, Richard Zisman.
Dr. Henry, I'm just wondering what your thoughts are on truck drivers and delivery people not having access in many cases to bathrooms to wash their hands, or restaurants on the side of the road or in cities because a lot of them are closed. And do you have any concerns about what this will mean for those essential workers on the road?
Yeah, and I've heard some stories about this, both for essential workers and for others, for people living on the street, some of the challenges they've been facing being able to do things of personal hygiene. So I know there have been provisions put in place in many places, and the important things are being able to have the the hand washing abilities, facilities being able to clean the bathrooms, and I know there's been efforts. At least I understand in British Columbia there has been, and I know across the country, and I hear from colleagues in the US as well, to make sure that these facilities can be open for people. Again, restaurants may be closed, but the ability to have takeout and to ensure that there is cleaning products available, that people are able to effectively clean their environment, but also wash their hands and to be able to maintain their personal hygiene in these very important essential routes.
Next question, Matt Prepost, Alaska Highway News.
Oh, hi, good afternoon, Doctor. I'm hoping you can provide some context about the case numbers to date here in northern BC. How many are hospitalized, how many are recovered, and the like. Thank you.
Sure. And it will be out in our statement, the absolute numbers, but we had 50 new test positive cases, which brought us up to 1,066 people who've tested positive in BC. That includes 142 who are currently in hospital, 67 of those people in the intensive care or critical care areas, and 606 are fully recovered in BC right now.
Great. Next question is from Victor Kaiser, Radio NL.
Hi, Dr. Henry, or perhaps for Minister Dix as well. I was just curious, with the Premier yesterday and then Minister Dix towards the end of your, your comments at the opening, are there concerns perhaps that people maybe are letting the foot off the gas, knowing that over half of the people have kind of recovered, and maybe not taking some of the measures too seriously perhaps? I'm not sure if that's a fear you have.
I'll start by saying, I have been, maybe I'm an optimist, but I think if it's Canadian and it's people in BC, we want to do the right thing. We believe in our communities where it's in our nature to support each other through these things. And my experience through my colleagues who are managing this in the day-to-day basis, so people who have this disease and people who are in quarantine are being contacted. And everybody, for the most part, wants to do the right thing. And if we give them the means to do it, they're able to do the right thing. And this is where it's so important that we as a community support people. You know, people are coming back and they're thinking, well, how am I going to get groceries? What am I going to do? So this is where we need to reach out to people and not be afraid to reach out and ask for help as well. Because if you are in quarantine, you should not be going to the grocery store. You should not be going to the pharmacy. So we need to support you in being able to do that because it protects all of us. I've also had, you know, many people who've worried about their pets, and there's ways that we can support them in walking their dogs. Though I must say, there's a lot of very happy pets around these days because I think there's so many people at home with them. So I do believe that most people are doing the right thing. I think the messages they get when they come into the country sometimes need to be beefed up. And that I've heard from many people, oh, I wasn't really told that I couldn't do this or I couldn't do that. So that is something that we are working with the federal government on to make it crystal clear for people that if you are in quarantine, it means you're a risk for having this disease, and we don't want you to pass it on, nor do we, most people, want to pass it on to anybody else. And these are the things that you need to do now.
I mean, we heard in one of the earlier questions about someone who had had a procedure canceled. There are lots of people that have had to make extraordinary sacrifices in their lives. I've heard from many of them. And so what we saw when we presented data last week, what we see in the community is people absolutely following Dr. Henry's orders. We see it in the number of people on transit. We see it in the number of people on ferries. We see it in the number of people driving around. We see that people are following. What we're saying, though, is that our success in the coming weeks in limiting the growth of COVID-19 in BC will depend on all of us. And so this is a message we have to deliver every day. I thought the Premier did that in a very clear and necessary way last night, but it's a message you're going to hear us reinforce every day. With respect to people coming back to Canada, who are returning to Canada, whether it's on government-sponsored flights or commercial flights that the government has helped to arrange, I simply say that we have to ensure that that message is delivered for their sake, but also for the sake of the entire community. I'll just give you a very simple example. There will be cruise ships that are going to be where people are going to come back to Canada in the coming days, and the Prime Minister referred to this, and I know, and I mean this with absolute support for the efforts being made by Global Affairs Canada in helping people. But the Herculean task doesn't end when people arrive in Canada. It only begins. And significantly in previous cases, for example, with respect to cruise ships, the Diamond Princess and I think the Grand Princess, which you'll remember was off the coast of California, people were taken back and in quarantine. Well, if that is not to be the case now, and they were brought to Trenton or they were brought to Cornwall and they were in quarantine, and there was very clear circumstances there, if it's the case that we're saying that they can return to the community, then that message has to be so clearly delivered and in such a way upon arrival and throughout the trip that there can be no misunderstanding. We need everybody involved, and our ability to bend the curve depends on that. It is an inspiring thing to see people, what people have done in the last few weeks in BC. It is inspiring. I am proud to be someone from British Columbia and see the community respond this way. But can't be 80%, can't be 85%, it's got to be 100% if we're going to do what we need to do to support our healthcare workers, to speak to all those people who had their surgeries canceled and say, this was an enormous sacrifice, but something happened here that the whole community got behind, and that people are with you in your struggle. To do that, we need everyone to be on board, and that's the message the Premier delivered last night, and that's the message I expect we'll be delivering every single day.
Okay, next question is from Simran Singh, Daily Hive.
Hi, Dr. Henry. I just wanted to ask quickly, what are your thoughts about at-home testing kits? I know there's some on the market. Some doctors are, saying that they should be used. I just wanted to know, is that something you approve of?
Yeah, there's no at-home testing kits that have been validated yet that I'm aware of. So the problem is they have false positive and false negative tests that are out there right now. So there is potentially a role for these at some point, and there's none right now that are good enough to be used in our community. There's also some really innovative stuff coming in testing. We have what are called point of care, but really they mean there's a type of machine that we can put in a small community. You don't need to have the big provincial lab to be able to do this kind of testing, or a hospital-based lab. So some of those will become available sooner. There's one, well, there's a couple that our public health lab is validating now that I'm hoping will be able to deploy to places like the north, where it's such a challenge to get testing because of the turnaround time and the transportation links. And of course, as the flights are being canceled and the transportation links are becoming fewer, it becomes even more of a challenge. So those are the strategies that we're looking at right now to try and make sure that we can test those who need it. The other ones that we are waiting for, and we talked a little bit about this yesterday and a few other days, but are what we call serology tests. So these are ones that tell you if you've had the disease and if you are now immune. And so they don't help us in determining whether I have the disease today, because it takes some weeks for your body to develop these antibodies. But what they are really helpful for is telling us how many people in our community were actually affected. And it helps us with, particularly with healthcare workers who've had this, being able to say, yeah, you have the antibodies now, you're immune. So that gives us some reassurance in terms of working with people who have this disease going forward. We don't know how long the immunity lasts, but we expect that it will be at least months, and that's what we're seeing come out of some other countries. But all of these tests are really the at-home point-of-care ones. There was a huge number that were bought by one of the states in the U.S. that turned out to be so unreliable that they ended up getting rid of them all. So right now, there is no at-home test that is reliable.
So for any reporters that didn't get to ask a question today, there will be a statement released this afternoon with all the information covered off today. For recommendations on protecting families and communities from COVID-19, visit www.bccdc.ca/. For any non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Our last question comes from Keith Baldry. Go ahead. Keith? I'm sure it was very important. Okay, I guess that's it for today then. Thank you.